We are seeing part 2 of our topic, meningitis. We are going to answer this question on how to diagnose meningitis. When you see where the infection comes from, we will realize that it can come from other infections. It can be urinary tract infection, where the infection will be transported from the urinary tract to the brain via bloodstream, that hematogenous route. Another route can be infection in the face, okay, or in the nasopharynx, in the sinuses, like a sinusitis. These are normal sinuses, and these are sinuses with pus. This can move easily from here to the brain. Or there is infection in the ear. This is a pus in the inner ear. You see, this is a normal ear, this is external, this is eardrum. There is a pus here. This is an infection that can move from here to the brain easily. So when a patient presents to the hospital, the patient might present with purpuric rash, especially when it is meningococcal meningitis. These rashes are very characteristic, and when you just take a glass as a test, a way of testing it, you press this rash. It's red. It does not disappear. It's characteristic when you are testing this rash. Another way of diagnosing for babies, a baby might arrive being pale. There is no blood coming. Most of times because of extremities which are very cold, the blood does not reach extremities. It's pale here, and you see this one is pink. There is a huge difference. Okay, or the baby might be having stiff neck, though it is not common in babies. The stiff neck is common in adult. The baby might be irritable. Baby might be floppy. You can see the muscle tone is okay on this baby. This baby is floppy. This is a very characteristic for babies who are having meningitis. The crying is not normal. The baby will be moaning instead, or staring at you. Okay, abnormal expression in the face, vomiting or refusing to feed, difficult to wake up, or the baby is very lethargic, very weak. Okay, the fontanelle might be tense or bulging. When we talk about bulging fontanelle, this is a normal fontanelle. It's not swollen normally between these bones, and here when it is swollen, we call it bulging fontanelle. It's a lot of pressure within the brain. Okay, the fever, possibility of cold extremities, hands and feet. For older children and adults, the drowsiness is common. The patient might be drowsy. Severe headache is very common with meningitis. The rash might develop as well. Vomiting, sometimes diarrhea, and the patient will dislike bright lights. That's what we call photophobia. The joints and the muscles will be very painful, and sometimes stomach cramps. The neck stiffness, which is very common, will not allow the patient to flex the neck. The chin cannot touch the chest. It will be a stiff neck. The high temperature, fever, and the possibility of cold extremities, hands and feet. Then the patient might be confused. Disorientation is a common possibility of fitting due to the brain which is affected. There are very important tests that need to be done when you want to diagnose meningitis. One of them is the Bruising Ski Sign. The Bruising Ski Sign, you will flex the neck of the patient. As you try to just flex a little bit, you will see the hip and the knees getting flexed automatically without touching them. This is a very important sign when there is meningitis, Bruising Ski Sign. Okay, another one is a Kernig sign. Kernig sign is where you try to flex the hip, okay, and extend the knee. You are trying to make 90 degrees the leg with the body, but doesn't happen that way. There will be resistance because there is a stiffness of this muscle, the hamstring muscle, and it will be painful if you try to extend the knee. Okay, this is a very important test to do when you want to diagnose meningitis. Another one that is a confirmatory test is to do lumbar puncture. You need to take a fluid from the spine and go and do examination. So, but before you do it, you need to do CT scan. CT scan it is not necessarily done always unless there is what we call a retarded mental status. The patient is in a coma, you don't know what is going on, better to do CT scan first. Or you can see there is focal neurological deficit, or there is papilloedema. The papilloedema is when you take your ophthalmoscope, you look in the eye, you check back to the eye, you see at the retina. When you see edema, there is edema, it tells you that there is a lot of pressure in the brain. It tells you that there is a problem. So it will be a contraindication of lumbar puncture. So if a patient is in seizures, you don't do lumbar puncture as well. Or the patient is a traumatic patient has a trauma, you cannot do lumbar puncture because it will cause more complications than what you want to resolve. So CT scan and LP should not delay the treatment. If the patient present, you suspect meningitis, you start your treatment immediately. Then you can do CT scan. Then if you exclude now the problems which can be the reasons of complications, then you do your lumbar puncture. So the lumbar puncture, as it is a very important test to do, you need to do it here at the back. We remember that we saw there is a fluid that surrounds the brain. It keeps on saturating around here and it comes to the spine downwards. So when you want now to diagnose what's going on around the brain, you can take this fluid from the back. Normally, you will find it here in the lumbar region, between these bones, between L3 and L4. The doctor will know very well where to take this fluid. Or L4 and L5. There is a space compared to other part upwards. So, and now once you have taken your lumbar puncture, your fluid, you need to put in 3 tubes, as you need to diagnose different things with those tubes. You have cleaned well, disinfection is done, no bacteria you are introducing. Then you start collecting your fluid and you put in different tubes, plain tubes, where you need to take for examination of what type of bacteria is it. That's what we call gram stain. Or you go look what type of cells are there. Are there some cells which came to fight infection? If they are increased, it is confirming there is an infection, yes. Polymorphonuclear, or you check if there are proteins, the elevated proteins in the fluid, cerebrospinal fluid, is abnormal. If the sugar is decreased, normally we are supposed to have at least 2/3 or 2/3 of blood, of the blood sugar, yes, 2/3, which is 60%. If it is low, it will tell us that bacteria has been there consuming that sugar. Then you cannot forget to take a blood, where you need now to do full blood count, and you can also do culture to identify was infection from the blood going to the brain. You need to do chemistry. You need to examine the renal function. You need to do a full examination. You need to do also chest X-ray, because it have been identified in the different studies that 50% of meningitis with streptococcal pneumonia meningitis, patient will be having chest infection, pneumonia. Then you can also do EEG, electroencephalogram. So these are the very important techniques that you can use to diagnose meningitis. We have seen this in very short, in summary, that is hopefully giving more clarity. So we'll see more and more as the other topics are coming. Then the next one is going to be how to manage it. Don't miss it. We will continue our health education and our health promotion.